Today we're going to talk about the Pakistan vaccination program. Now, the government of Pakistan is signed with COVAX, which is a program of WHO, World Health Organization, the UNICEF, and other global partners. The COVAX program is designed specifically to provide vaccine, equitable distribution of vaccine, COVID-19 vaccine, to all the developing nations and underdeveloped nations of the world. So the government of Pakistan signed with the COVAX 8 months back, which is a great achievement by the government of Pakistan. Under the COVAX program of WHO, Pakistan will receive about 17 million doses of the Oxford AstraZeneca vaccine in the first half of 2021. 7 million of the British, Sweden, Oxford AstraZeneca vaccine doses will reach Pakistan by March 2021 and this year, and the delivery will start in February. Dr. Faisal Sultan, who is the advisor to the Prime Minister of Pakistan on health, said that COVAX timely support and delivery of COVID-19 vaccine is a testament of global stakeholders' trust in Pakistan's preparedness for vaccine rollout. Dr. Faisal Sultan also said, the special advisor to the Prime Minister of Pakistan on health, said that he is confident that the government of Pakistan will meet its plan of large-scale immunization vaccination program over the coming months in 2021. NCOC is responsible, which is the National Command and Operations Center. It is responsible in Pakistan for the COVID-19 cases and its report, and also now to oversee the COVID-19 vaccine administration strategy and all necessary measures, including logistics. The government of Pakistan had to construct a vaccine storage facility to maintain ultra cold chain. This has been constructed and in Islamabad. From Islamabad, this vaccine, all vaccines which will be coming either from China and through the COVAX program, the Oxford British, the UK Oxford AstraZeneca vaccine, COVID-19 vaccine, will be distributed from Islamabad to the provinces of Pakistan. The 500,000 or 5 lakh doses of the Chinese Sinopharm vaccine will reach Pakistan in the next 24 hours now, because the vaccine Chinese Sinopharm vaccine, 500,000 doses are being given to Pakistan, I believe, for free, and this is a gift from the government of China to the government of Pakistan. China's Sinopharm COVID-19 vaccine, the UAE, United Arab Emirates, gave the Sinopharm, the China's Sinopharm vaccine efficacy rate at 86%. China's Sinopharm announced that the China's Sinopharm COVID-19 vaccine has an efficacy of 79.4% against coronavirus COVID-19. China's 500,000 doses will include the health officials, the first-line health workers, old people, older people, people over the age of 60 will be receiving this vaccine. By March, the 7 million doses of the UK's Oxford AstraZeneca vaccine will reach Pakistan, and this vaccine will be free. So please be aware of any sort of emails which ask for your financial information or any other links that you will get. Please do not click on those, because people who are swindlers, they are trying to get people's financial information or hacking their phones through these links. So please do not click on those. These vaccines are for free and are given by the government of Pakistan. Suspicious emails, you should either report these emails and to the so-called authorities, and there is a cybercrime network in Pakistan, and you can report these emails so that such emails can be stopped and these people can be taken to task. The UK's Oxford AstraZeneca vaccine will reach Pakistan by March 7 million doses. So remember, these are being administered by the government of Pakistan, and they're for free. Do not give your financial information or your credit card numbers or your debit card numbers or your personal information, or click on any links from any emails that you get, suspicious emails, because they're actually trying to hack your phones or take your card numbers and rob you. You will be contacted by the government of Pakistan. As of now, the government of Pakistan has made a list be getting the vaccine, and the first batch which is coming in from China, the Sinopharm vaccine, and especially those who are over the age of 60 years, they have been selected and they're being contacted by the government of Pakistan with a special code, and they're for free. The first tranche from China will reach possibly by tomorrow or day after tomorrow. It will reach Pakistan, and vaccination should start within 48 to 72 hours. They will then be distributed to all the provinces accordingly from Islamabad, because from Islamabad there is a ultra cold chain facility which has been created there, and through NCOC they will be then distributed to the provinces, KPK, Punjab, Sindh, Balochistan. This vaccine will be rolled out to all provinces, and depending on the healthcare workers and who's been selected. So it will be done equitably, and it will be done in a fair manner. Pakistan being part of the COVAX program. Now, COVAX program is the global program, and it is actually the global equitable access to COVID-19 vaccines. 2 billion doses of COVID-19 vaccine are to be distributed under the COVAX program. It is COVAX, COVAX. Now, WHO, World Health Organization, UNICEF, Gavi, and other global partners are working together. Their objective is the country's readiness and delivery work stream is part of COVAX. The COVID-19 vaccines pillar of the access to COVID-19 tools, which is the ACT accelerator, through the country's readiness and delivery work stream. WHO, World Health Organization, UNICEF, Gavi, and other global partners are working together at global and regional levels to develop, disseminate adaptable global goods, that is guidance, trainings to train the medical personnel to vaccinate people with COVID-19 vaccines, the tools, and the advocacy materials. The COVAX supports all countries and economies to prepare for COVID-19 vaccination program. So the Pakistan's vaccination program is now in full swing, and good part is that 500 doses of the China's Sinopharm vaccine are going to reach Pakistan in a day. They're just being loaded right now, was the information as of January 31st, 2021. So vaccination should start within 48 to 72 hours. The Oxford AstraZeneca vaccine is 90% efficacious if half the dose is given at day 1, and 4 to 8 weeks or 4 to 12 weeks the second full dose is given. It will give about 90% efficacy or protection against COVID-19. So in March 2021, Pakistan will receive 7 million AstraZeneca, the British, Swedish Oxford AstraZeneca vaccine. AstraZeneca vaccine is given in 2 doses. The first dose is given in about 4 to 8 weeks, but it can continue up to 12 weeks. The second dose is given, can be given from 4 to 12 weeks, but it's better if it's given within 4 to 8 weeks. And the data which has been received by WHO, that the half dose, if given, of Oxford AstraZeneca vaccine followed by 4 to 8 weeks or 4 to 12 weeks later by a full dose, gives 90% efficacy against COVID-19. By the grace and the blessings of God Almighty, Allah, Pakistan will conquer this COVID-19. There are different variants and mutations of COVID-19 which are occurring. So Pakistan will definitely defeat this COVID-19 and the immunization process will start within 48 to 72 hours. So Pakistan will become part of the so-called the COVID-19 vaccination program. Part of that will be included in the list of countries which are providing COVID-19 vaccination. By the blessings of God Almighty Allah, we should be grateful to God Almighty Allah that Pakistan will be, hopefully by the end of 2021, almost 60 to 80% of the population will be vaccinated against COVID-19. It's all about the government of Pakistan's vaccination program. And again, as I said, we should be grateful to God that Pakistan will be included in that list of countries which will become immunized and against COVID-19. And these vaccines will save our lives. But to remember that wear your mask and practice social distancing of 6 feet or 3 feet if you cannot maintain 6 feet. And to wash your hands and avoid touching your eyes, nose or mouth unless your hands are washed or sanitized. Those surfaces, whether it is glass or whether they're rails or whether they're doorknobs, the person who is infected with COVID-19 should isolate themselves, because if they cough or sneeze onto these surfaces, the COVID-19 virus can stay alive on these surfaces for up to 72 hours. That is the reason why when you touch something, when you're going out and you touch something, you touch doorknobs, you touch different things, make sure that you wash your hands before touching your eyes, nose and mouth. That's how the infection, the virus gets into your body, and the virus can stay there. Now, there are different variants of the virus. The initial virus, which was found in Wuhan, China, has now mutated, and these mutated variants to some extent can be covered by these vaccines. If the virus mutates, if the COVID-19 virus mutates further, then we will have a great problem, because then the vaccines would need to be upgraded, as is done with the influenza, Haemophilus influenza B vaccine, which is upgraded every year to deal with the mutations. And Pakistan, again, by the grace of God Almighty Allah, will be included in the list of countries which would be successful in immunizing its population. And this would be a great achievement, because Pakistan will be included in the list of nations in conducting successful immunization programs. All provinces of Pakistan will be getting this vaccine, COVID-19 vaccine. 500,000 doses of the China Sinopharm vaccine will reach us in 48 hours. By March, we will receive 7 million doses of the Oxford's AstraZeneca vaccine. Maintain the precautions against COVID-19 to stop its spread. If it spreads, it will mutate further. And with the blessings of God Almighty Allah, Pakistan will be successful in the large-scale immunization of its citizens against COVID-19. Maintain social distancing, wear your masks, wash your hands, and avoid touching contaminated surfaces. The COVID-19 virus is not affected by hot or cold weather. Avoid touching your eyes, nose or mouth unless your hands are washed or they're sanitized. Why I keep talking about COVID-19 vaccines or the virus is because it is spreading, and we must stop the spread of this virus. Dr. Zaib Khan signing off.